breastfeeding, prophylaxis against communicable diseases, and a key child survival strategy. Um, in the Allah the Almighty says, and if you decide on a wet nurse for your children, there is no sin on you, provided you pay what you agreed on a reasonable basis. In the event of divorce, the father has to give the mother her payment if she chooses to nurse their baby as elaborated in Surah At-Talaq, verse 6, verse 6, and if they are pregnant. In the event of divorce, the father has to give the mother her due payment if she chooses to nurse their baby as elaborated in Surah Al-Talaq, verse 6. And if they are pregnant, then spend on them till they deliver. Then if they give suck to the children for you, give them their due payment. The Quran has not only demonstrated to us the right of the child to breastfeeding, but it has also protected the rights of all persons involved in this noble nursing role. The mother and the witness and emphasized the responsibility of the father as the provider to ensure this nursing task is executed and adequately remunerated. The teachings of Islam go further to recognize the special bond that is established between the unrelated witness and the suckling child, that she immediately becomes a foster mother to the child. Her children will now become the child's foster brothers and sisters to whom marriage is not allowed. This close and unique relationship among suckling relatives was reaffirmed by the hadith of the Prophet Muhammad, as shown here. Indeed, Allah the Almighty has prohibited marriage among suckling relatives, as He has prohibited it among birth or blood relatives. The early Muslim scholars similarly acknowledged the importance of breastfeeding. Ibn Qayyim himself, a physician among others and author of Tibb Nabawi, prophetic medicine, wrote the following about breastfeeding. Babies should only be fed the mother's milk until their teeth appear. Their stomach and digestive system in the early months are incapable of handling solid food. When the baby's teeth come out, its stomach becomes strong and ready for food. Indeed, Allah delays the growth of teeth until the baby needs of food. This is from His wisdom and kindness, and out of mercy towards the mother and her breasts nibbles, so that the baby would not bite them with its teeth. Infant mortality. Currently, 6 million lives are saved each year by the very act of breastfeeding. UNICEF estimates that there is a potential to save an additional 2 million lives if optimal breastfeeding is practiced. The bulk of these infant deaths are due to gastrointestinal and acute responsibility infections. The various anti-infective factors, notably immunoglobulins, macrophages, lymphocytes, interferon, lysozyme, lactoferrin, and bifidus factor found in abundance in the breast milk, confers this early the effective prophylaxis against a whole host of microbes. Breast milk would effectively be the baby's first immunization colostrum, the first milk, is dense with antioxidants in the form of vitamin E and beta carotene, which protect the baby's body tissues from microbial invasion. It facilitates the establishment of the bifidus flora, hence antagonizing other pathogenic organisms and prevents attachment of E. coli and similar bacteria to gut lining. Unfortunately, many cultures erroneous consider colostrum a pus-like looking fluid as impure, full, and is discarded, hence depriving the baby a head start in its defenses against a variety of microorganisms. The Philippines study found that the risk of diarrhea is 17 times higher in the formula fed infant when contrasted with the breastfeeding infant. This vicious cycle of formula feeding, gastrointestinal infections, dehydration, and malnutrition is further exaggerated by poor hygiene, inadequate sanitation, facilitate contamination, water supply, and poor knowledge of milk preparation. These in favorable health ambience is unfortunately most evident in developing countries, and hence the devastating consequences of substituting human milk with cow's milk. Acute respiratory infections ARI contribute to well over 25% of all childhood mortalities in developing countries. It is also the most common cause for clinic visits and hospital admissions for formula-fed infants. Are 5 times more prone to acquire ARI. Their infections tend to be more severe and they are more likely to require hospitalization. The prophylactic effect of breast milk against a whole host of ARI has been demonstrated, including RSV, bronchiolitis, otitis media, and pneumonia. A Brazilian study showed that formula-fed infants were 4 times more likely to die from pneumonia than breastfed infants. The benefits of breastfeeding vis-a-vis mortality is not merely enjoyed by those in developing countries, but also extrapolates into industrialized world nations. Risk-benefit analysis undertaken in the USA shows that optimal breastfeeding decreases mortality in the first year of life by 4 per 1,000 live births. The major cause of deaths in the USA in the first year of life beyond the neonatal period is sudden infant death syndrome, SIDS. The relative risk of SIDS is Caucasian breastfed infant is 0.2. That is 5 times lower. Most health authorities in North America and Europe have advocated breastfeeding as one of the major preventative measures of to further reduce this most tragic, unexpected, and premature death. Infant nutrition. Breastfeeding offers the optimal nutrition for infants with the best balance of nutrients. The protein components, which is the lowest among mammals, is an alpha lactalbumin, unlike beta lactoglobulin in cow's milk, has as shown in favorable way casein ratio and is taurine rich. The osmolar load hence presented to the relatively immature kidneys is therefore low. Fat is the most variable component, and the rich um, in docosahexaenoic acid, rich in doxahexanoic acid DHA and um, arachidonic acid AA, which is vital for brain growth and development. Human milk has um, the highest lactose content in comparison to other mammals. Lactose is a precursor for galactose, which is incorporated in brain tissue as galactolipids, a crucial building block for optimal brain growth and development. It also helps to promote colonization of the gut with a friendly lactobacillus bifidus and facilitate the absorption of calcium and iron. A bountiful of minerals are found um, in human milk. The calcium phosphate ratio is ideal for calcium absorption and iron, though found in small quantities in 70% bioavailable, unlike 30% bioavailability of iron in bovine milk and meager 10% of bioavailability in formula milk, hence fortified with extra iron, which only contributes in constipation. Many of these nutritional extras in human milk are not found in milk formulas, hence the milk industries incessant or incessant scientific um, endeavors humans as bovine or bovine milk formulas by adding the likes of beta carotene, taurine, and nucleotide DHA and AA. These various added nutrients are used as marketing gimmick um, of to outdo their or their rivals in terms of conferring brain power and added IQ points to the bottle-fed babies, and advertised as being closest to breast milk, mimicking all the wonders found in this Cinderella milk. Breastfeeding and intelligence. That breastfeeding makes babies brainer is now an undisputed scientific fact. Lucas, in his very interesting British follow-up study of premature infants, reported that children at ages 7.5 to 8 years who received breast milk had an 8.3 point advantage in IQ scores. The researchers were also able to show a dose relationship between the amount of breast milk fed and the subsequent IQ outcomes. The New Zealand longitudinal study, which examined the association between the duration of breastfeeding, childhood cognitive ability, and academic ability from the ages of 8 to 18 years, showed an increase in cognitive ability and educational achievement, which extended into childhood and early adulthood. Cow's milk and allergies. Various allergic syndromes are associated with formula feeds, often due to an adverse immunological response to the foreign beta lactoglobulin in bovine based formulas. The spectrum ranges from a gastrointestinal symptoms of um, infantile colic, vomiting, diarrhea, or blood stools, mal absorption, to skin manifestations of eczema and respiratory complications of allergic rhinitis and bronchial asthma. Cow's milk and the long-term morbidities. Various studies have also implicated the consumption of cow's milk with long-term morbidities. Epidemiological data from Denmark suggests an inverse correlation between breastfeeding and type 1 diabetes mellitus. This was thought to be attributable to an antibody against bovine serum albumin BSA, which selectively destroys pancreatic islet cells. Breast milk is essential for the normal development of immunological competence of the intestinal mucosa that a total of 826 current patients studied against matched controls showed a statistically significant shorter mean length of breastfeeding. Lack of infantile breastfeeding was similarly a risk factor for the development of um, ulcerated colitis. There is very interesting geographic distribution of multiple sclerosis worldwide. It is rarely reported in countries where breastfeeding is prevalent. Paucity of breastfeeding in early childhood is associated with a 6-time relative risk of developing lymphomas in later life. The exact mechanism leading to these myriad of immunological syndromes is as yet ill understood, but there is uncontrovertible evidence to suggest that breastfeeding promotes long-term health. Breastfeeding and women's health. The woman who breastfeeds also enjoys various benefits as a consequence. Immediately post parturition, the oxytocin released during breastfeeding helps to contract the uterus and reduce the incidence of postpartum hemorrhage and later anemia. Exclusive breastfeeding offers 98% protection against getting pregnant during the first 6 months. This is called the lactational amenorrhea method, LAM, and universally this is still the most effective from the contraception available to every lactating woman, unlike the more costly and less available contraceptive pills and intrauterine devices. Breastfeeding reduces the risk um, of breast and ovarian cancers in mothers. A multi-center study in the USA found that the relative risk of breast cancer among a menopausal women decreased as the duration lactation increased. A multinational study from Australia, Chile, China, Mexico, the Philippines, and Thailand found that the relative risk of ovarian cancer decreased as the duration of lactation increased. Breastfeeding confers untold psychosocial benefits to the infant mother diet. This instinctive and innate activity at birth bonds the mother and child, which has a lifelong loving and therapeutic effect. Mothers who breastfeed their babies are less likely to abuse or abandon their babies, a social phenomenon which unfortunately is on the climb in recent years.